So this is a left clavicle that I shot on a 44-year-old male who fell off a bike, or I believe it was a motorcycle. The patient's status, he was very alert, but he was in a lot of pain, and he came in with a sling. Image receptor information. It was a 16 by 16 digital receptor. The technique, I believe, was 75 kVp at 6. The range for this system, I'm not sure exactly what it's called, if it's DI. I believe it's DI, but the range is -5 to +4. And our range came to -1.2, which was right in the range. Contrast wanted for an upper extremity like this would be on the higher scale with more black and whites. There was a 40-inch SID. So I believe this is the AP, and so I shot it perpendicular, and I made sure to have both the sternoclavicular joint and the acromioclavicular joint. For the AP axial, I centered the same way. This is a AP axial. I just made sure I did a 20-degree angle. I know it's 15 to 30 degrees. He was pretty average size, so I just did 20 degrees. I don't have the physician's findings. I accidentally shredded it because it was in my binder, and I don't want to take it home, and I accidentally shredded it instead of writing the information down. So I guess I was going with HIPAA, but I accidentally forgot to write down the information. But I do remember it's saying that, I don't know if this is a convoluted fracture or some sort of fracture. Obviously here it's very apparent that there's a fracture there. And here. Challenges. He came in with the sling, so maneuvering that was a little challenging. And then putting the shield on him too was challenging because he was in a lot of pain, so I was trying not to touch him, not to move him and stuff. And then for anatomy ID, this is the AP here. You could see the sternoclavicular joints here. The first rib is here. Acromioclavicular joint here. I believe this is the coracoid process here. And then here's the humerus. Proximal humerus. And yes, I almost comped on this, but I forgot to put a marker. Wait.